Hello, I'm Ronglih Liao. I'm the current BCVS Council Chair. Welcome to 2016 BCVS Scientific Section in sunny Phoenix. We are very fortunate today we have the current AHA President, Dr. Stephen Hauser from Temple University with us here. First, on behalf of BCVS Council, we would like to congratulate you being an AHA President 2016-17.
Thank you, Ronglih.
As a basic scientist yourself, we'd like to know what's your vision as a AHA President. What do you think about the basic cardiovascular research and its impact and relationship with clinical medicines?
So my view is that basic knowledge, basic discovery is the foundation upon which all novel therapeutics are developed to help patients who are at risk of developing or have developed cardiovascular disease or have had a stroke.
As a basic scientist yourself, can you tell us a little bit about your own research and how this is going to impact the future translational to developed therapeutics?
My lab is hoping to be able to make a contribution to the development of novel therapeutics for patients who have suffered an ischemic insult, a heart attack. We're working on cell and cell-based products that could be delivered to patients after an ischemic insult in the hopes that we can improve their cardiac structure and function and prevent the occurrence of heart failure, which often is a downstream consequence of a heart attack.
What's the big limitation that potentially can slow down the development of we translate the basic research to a clinical therapeutics?
I think one of the big issues over the last decade has been the instability in our funding environment. The federal government funding of research has been flat. We had an economic downturn that limited the ability to raise funds and fund research, but I think those days are coming to an end. So I'm very hopeful that in the next decade, we will have the resources necessary to take all the new discoveries that are being made every day by AHA-funded researchers and translate them into the novel therapeutics that we need.
Toward the fundings, so the AHA has been such integral part of the science and the clinic medicines. What do you think toward the AHA funding for the future?
I think AHA will continue to provide funding for fundamental discovery, for clinical trials and early stage clinical work, and for population science. All types of science, I believe, are important to us meeting our 2020 and eventually our 2030 mission statements and mission goals.
So you have been such a successful investigator and being served as a role model for many of us. What advice would you give to the younger generations at the students, postdoc, and early stage career investigator?
I would advise them to follow their dreams and follow their curiosity and follow their passion for science. I think if they're passionate about their work and work as hard as they can, I know they're all bright enough to make great discoveries. And so I think keeping your enthusiasm at a high level through the ups and downs of science is important for them to have long, rewarding careers.
Thank you, Dr. Hauser. This is a very exciting conference and it's really a pathway to therapeutics. And today we have our very own BCVS long-standing council member today as AHA president. And we have an exciting program. We have more than 500 attendees, come from more than 20 countries here. So from here, you will strike your new collaboration and help Dr. Hauser to move our AHA 2020 goal one day closer. Thank you.
Thank you, Ronglih, and have a great conference, everyone.
Thank you.